Imagine this. You're pulled over, searched without a warrant, and arrested for carrying a small bag of marijuana, something legal in several states today. But for you, this mistake results in a 20-year sentence. No violence, no theft, just a personal amount of drugs, and your entire future gone. This isn't rare. It's the result of a government policy launched with good intentions, public safety and social order, but carried out with consequences that reshaped America's legal system, prison population, and even the way we define justice. This is the war on drugs. At its start in the early 1970s, the war on drugs was framed as a necessary defense against addiction, crime, and the breakdown of American values. But behind the scenes, it was also a tool for political power, racial control, and mass incarceration. The effects? Skyrocketing prison populations, militarized police forces, families broken apart, communities devastated. So here's the question we'll explore. Did this campaign protect our nation, or was it a war waged against our own people? In this video, we'll walk through the historical origins, the legislative machinery, the winners and losers, and the ongoing debate around reform. You'll see how policy shaped lives, and ask whether it's time for a new approach. In the late 1960s, America was changing rapidly. Anti-war protests filled the streets. The civil rights movement challenged the status quo. And drug use, especially among youth and returning soldiers, became a growing concern. Heroin addiction was rampant among Vietnam veterans. LSD and marijuana use surged during the counterculture movement. The fear of societal collapse was very real for many Americans. In 1971, President Richard Nixon declared drug abuse public enemy number one, but internal memos later revealed political motivations. According to Nixon's domestic policy advisor, John Ehrlichman, targeting drugs was also a way to control anti-war activists and Black Americans by associating both with drug crimes. This wasn't just about health, it was about power. 2 years later, in 1973, Nixon established the Drug Enforcement Administration, DEA, a federal agency solely focused on drug control. With this move, the groundwork for a multi-decade campaign was laid, a campaign that would come to define American criminal justice policy for generations. The legislative backbone of the war on drugs began with the Controlled Substances Act of 1970. This law created 5 schedules of drugs based on medical use and potential for abuse. Schedule 1 drugs, like heroin, LSD, and marijuana, were labeled the most dangerous and illegal under federal law, regardless of state policy. But enforcement ramped up significantly in the 1980s under President Ronald Reagan. Public concern about crack cocaine and media panic around drug-fueled violence spurred Congress to act. The 1986 and 1988 Anti-Drug Abuse Acts introduced harsh mandatory minimum sentences. 5 grams of crack cocaine now meant 5 years in federal prison. It would take 100 times more powder cocaine, 500 grams, to receive the same sentence. This 100-to-1 sentencing disparity disproportionately punished Black Americans and low-income communities. Nancy Reagan's Just Say No campaign flooded schools and TV ads with anti-drug messaging. While well-intended, it reduced complex addiction issues to simple slogans and increased stigma rather than understanding. These laws passed with bipartisan support. Democrats and Republicans alike raced to be tough on crime, but the results were staggering. Longer prison terms, more aggressive policing, and fewer chances for rehabilitation. The war on drugs reshaped the justice system from the ground up. Judges lost the ability to consider context or intent when sentencing. With mandatory minimums in place, a teenager caught with a small amount of a controlled substance could face the same punishment as a seasoned trafficker. The DEA's role expanded, and police departments across the country received federal funding to increase drug-related arrests. Civil asset forfeiture laws allowed officers to seize cash, vehicles, and property suspected to be tied to drug crimes, often without filing any charges. Police militarization followed. Small towns acquired military-grade vehicles. Tactical gear became standard. Drug raids became more frequent and more aggressive, sometimes targeting the wrong house, with fatal consequences. Prosecutors leveraged strict drug laws to pressure defendants into plea deals, avoiding trial and inflating conviction statistics. Over time, justice became less about fairness and more about efficiency. The human cost was enormous. In 1980, the U.S. held fewer than 50,000 people in prison for drug offenses. By 2000, that number had exploded to over 500,000. Today, over 1.1 million people are in custody for drug-related charges in jails, prisons, or under probation and parole. The impact was not evenly spread. African Americans make up just 13% of the U.S. population, but accounted for nearly 40% of drug-related arrests. Latino communities also faced disproportionate targeting. Families were broken apart, children were raised by relatives or placed in foster care, while parents served decades for nonviolent offenses. Entire neighborhoods lost generations of fathers, sons, and brothers to a system that prioritized incarceration over intervention. The stigma followed people even after release. A drug conviction can block access to housing, employment, education, and voting rights. One mistake, magnified by law, became a lifelong sentence. In the mid-1980s, crack cocaine hit urban communities hard. Media coverage was relentless. Stories of crack babies, violent turf wars, and collapsing cities filled the news cycle. But much of it was sensationalized. Crack and powder cocaine are chemically almost identical, yet the penalties were wildly different. The government responded with even tougher laws. Police flooded black communities with surveillance and raids. The image of a dangerous, addicted inner-city criminal took root in the national psyche. Super predators, a term later debunked by its own creator, justified youth incarceration. Harsh school discipline and zero-tolerance policies mimicked drug laws, feeding into what we now call the school-to-prison pipeline. Public fear overrode data. The moral panic turned into law, and the damage was done, fueled by distorted narratives and ignored evidence. By the 2000s, cracks in the foundation started to show. Studies revealed that harsh sentencing wasn't significantly reducing drug use or crime. Public health experts began urging for addiction to be treated medically, not criminally. In 2010, Congress passed the Fair Sentencing Act, reducing, but not eliminating, the crack powder disparity. States began experimenting with drug courts, offering treatment in place of prison for low-level offenders. Activists and civil rights groups exposed the racial and economic inequalities of the war on drugs. Lawsuits challenged the constitutionality of stop-and-frisk, no-knock raids, and civil forfeiture. Public opinion shifted. Surveys showed growing support for marijuana legalization and criminal justice reform. Conservative and liberal groups found common ground in reducing prison populations and restoring civil rights for ex-offenders. As opioid addiction swept across white rural communities in the 2010s, the tone of the conversation changed. Media outlets began covering addicts as victims rather than criminals. Compassion replaced condemnation. Government funding shifted toward treatment and mental health services. Marijuana legalization took off. Colorado led the way in 2012, and by 2025, over half of U.S. states had legalized or decriminalized cannabis. Record expungement laws followed, slowly undoing the harm done to millions for past convictions. New policies focused on harm reduction, needle exchanges, overdose prevention centers, and fentanyl testing strips signaled a shift toward health-based approaches. Yet challenges remain. Federal law still classifies marijuana as a Schedule I substance. Private prisons continue to profit, and many people still serve long sentences for outdated offenses. The debate continues. Some argue for full decriminalization, pointing to countries like Portugal, where drug use declined after shifting focus to treatment. Others call for a balanced approach, tough on dealers, compassionate toward users. There's also the question of justice for those already affected. Should past convictions be erased? Should the government provide compensation for years lost to policies now widely seen as unjust? From a conservative Christian perspective, we must balance justice and mercy. Scripture speaks clearly on the value of life, redemption, and second chances, but also on the need for law and order. How do we reflect that in our modern laws? Should we rebuild the war on drugs into a campaign focused on healing, recovery, and personal responsibility? Or do we need to end it entirely? For over 50 years, the war on drugs has shaped American life. It was born from fear, sold as justice, and executed with power. It punished addiction instead of healing it. It divided communities instead of protecting them. But change is possible. We've already seen steps in the right direction. legislation, public awareness, and grassroots reform. Now it's time to finish what's been started, a shift from punishment to restoration. What does that look like to you? Should we invest more in drug treatment and mental health services? Should we release non-violent drug offenders still serving long sentences? Should we hold policymakers accountable for decades of unjust laws? Leave a comment below. Let's hear your thoughts on how we move forward, not just legally, but morally. Don't forget to subscribe for more breakdowns on America's most controversial laws and their impact. Hit the like button if you found this video insightful, and share it with someone who still believes this war made us safer. Let's keep the conversation going. Let's write a better chapter together.